Visit to Indus hospital, and
all the things are free of cost in this hospital.
They were quite unique, if so well interiorly designed department with
proper prescription handling as well as appropriate documentation.
they are using very functional paperless tools, especially
And was quite realistic, well organized and properly maintained. Absolutely fabulous.
Assalamu alaikum. Last week we had visited to Indus hospital, and after visiting we have learned so many things, that how things work in professional life, especially when you are in healthcare profession, that emerges the recommendations, like the things that we observe there, the responsibility of pharmacists, the work efforts, and all is important. That's what we are going to share with you in this video. So let's start.
It was a great experience while visiting the Indus hospital. It was a 350-bed tertiary care multidisciplinary hospital. This organization started in 2007. I like the most that it's the first paperless hospital, and all the things are recorded on the computer while using different softwares. And the second thing is there are no cash counters. All the things are free of cost in this hospital. While talking about the pharmacy services, we observe OPD pharmacy, central pharmacy, and clinical pharmacy. At the end, I like to suggest that they should include the number of pharmacists in as per the departments, as per the need. Thank you.
Assalamu alaikum. Coming to the conclusion of our visit in Indus Hospital, I would like to mention two things. That was unit dose dispensing system and the inpatient pharmacy practices that they were following. They were quite unique. If I talk about the other hospitals in Pakistan, they are lacking such systems, that is unit dose dispensing system and inpatient pharmacy services. Being a student, I personally say that we should practice TPN, and TPN is the major part in pharmacy. Only dispensing is not our responsibility. Our responsibility should be proper dispensing, proper compounding, proper TPN calculations. If I talk about Indus Hospital, it was quite well established, and if I talk about the services they are providing, were quite excellent. Being a student, it would be my message to every pharmacist out there in a student life, or they are in the final year, or they are graduated even. They should practice very well because this is the learning phase. When you come in the practice life, you will practice these things. But the learning phase starts from the student life, where you should know about dispensing, where you should know about the TPN calculations, where you should know about each and everything related to pharmacy, because you are going to provide knowledge to other people. So in the end, I would like to say that if you are going as a pharmacist in other organization as well, even if it's not in this hospital, you should suggest them that what practices they should follow to make pharmacy system better. Thank you.
Our very first visit in the Indus hospital was of pediatrics department, and the first thing which I have noticed once I have entered that department was the interiors. Like, it was so well interiorly designed department with bright colorful walls and with decent cartoons. I think that was totally relatable with the children's. And mainly if I talk about the pediatric pharmacy services that they were providing, so I guess that was one of the exceptional services that they were providing, because they were using all sort of advanced softwares which we have studied so far, such as like computerized physician order systems and HIM system for the tagging of the drugs, and for the high alert drugs they were using auxiliary labels on as well. So I do think so that other than dispensing, it is a huge responsibility of a pharmacist to at least know about that how these softwares are has to be worked, and most importantly, it is a huge responsibility for pharmacists to prepare the auxiliary labels and put them on the drugs. Like, if you are not doing that, then what's the reason that you have the degree of pharmacy? So it is a huge responsibility, I guess. And secondly, I do think so the best part I have seen there was the counseling. The pharmacists were doing the counseling. They were telling people that how these drugs has to be used, and how what will be the schedule, and what could be the probable side effects. So I do think so as a pharmacist we should be knowing at least minimum information that what we are dispensing so that we can promote the rational drug use. So that was one of the good part. And secondly, I have observed that they were also providing pediatric oncology services as well. So I do think so that is a good initiative because I don't think so any other oncology hospital services, any other hospital is providing oncology for the pediatric services. So that is a good initiative, but the thing I have noticed there was the compounding. They were compounding the sterile products so costly and so well organized. Everything was so well organized. The sterile part was totally different from the non-sterile compounding part. So I do think so that was a very good initiative, and they were also doing or making the dilutions, the TPN preparations, dose reductions, dose adjustments. So as a pharmacist, I would recommend that as a student we should be knowing at least how to do the dose adjustments or how to do the calculations of the TPN preparations so that we can promote the rational drug use and obviously to get the good recognition as we always want. So yeah, that's my part. Thank you.
During the Indus hospital visit, we observed an out-class emergency pharmacy services, which are designed according to the patient need and severity. Like for outpatients, RATA and MATA services are provided. RATA is a rapid assessment treatment area, while MATA is a major assessment treatment area. Like we also observe for inpatient pharmacy services, which comes under the umbrella of P1, P2, P3 and P4 services. P1 and P2 are critical emergency patient which needs more care. We also observe proper prescription handling as well as appropriate documentation in Indus hospital pharmacy.
The inpatient pharmacy services of Indus Hospital is operating remarkably with their effective inventory management. They are using very functional paperless tools, especially HIM system that's not just helpful for the healthcare professionals and patients, but also for the betterment of our planet too. They also offer rescue therapies, extemporaneous compounded preparations, and much, much more.
Every data is documented. They have proper supply chain for the drugs or necessary medical supplies. They have software which keep them up to date about the drugs and the inventory and the drugs stock, etc. Thank you. That was all about I have observed in the warehouse.
Assalamu alaikum to every one of you. I'm here to describe the inpatient compounding or inpatient pharmacy services that was provided in this hospital and their premises. So basically, it was quite similar to that services that we have studied in the academic section and was quite realistic, well organized and properly maintained. Absolutely fabulous. So basically, the things that I observed, specifically if I talk about inpatient compounding services, so that was the sterile, non-sterile and the general area that was specifically separate from one another. Sterile area was there for only with the fluids or the medication that required 100% stability and sterility, like the IV fluids, and to maintain the stability of the product, a proper laminar flow hood system was there, and it was an amazing experience not only for me but also for other students to visualize that proper flow hood system. And next, if I come in the non-sterile section, so there were also the extemporaneous preparation and TPN preparations both at the same time that was made, and it was something that was a new explore for every one of us, and we actually had observed it just in the academic sections and not yet in any other section. So when we relate the academics versus with the realistic situation, so that was quite similar, and it was completely an amazing thing. There was also a proper computerized system that was the software was of HMI, which was Indus itself has a computer software, so that was also something that was quite unique, and a lock and key system was there in order to maintain the
Through this visit, we are able to learn more about hospital pharmacists, their duties, their active and central part in patient therapy plan. And this visit could be even more better if we can extend our visit and able to experience how actually drug is dispensed from satellite pharmacy to respected ward and then administered to respected patient. Thank you.
So guys, I'd like to wrap up and summarize the video altogether by saying that it was a great opportunity for us to be there to visualize the system altogether. And furthermore, I'd like to thank the entire staff members for the complete guidance, for their motivation and their encouragement. And it was a huge opportunity for not only me, but also the entire batch of AUW to see the adverse situations and to see that how it actually works and how it actually implements in the realistic world. And I would like to thank the entire batch of Indus for cooperating with us with such regards. And yeah, Indus is doing such a great work by serving the mankind and by promoting the message of humanity with all their dignity, with all their strength and courage, and I wish them all the very best of luck for future.